Good morning. Thanks for attending. Today I'm joined by Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to provide an update on local COVID-19 situation, as well as Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the vaccine rollout. Before we begin our press conference today, I want to take a moment to pause and acknowledge the remains of the 215 children found at the site of the Kamloops Indian Residential School in Tecumseh-Secwepemc First Nation. We recognize this unmarked, undocumented burial site reignites trauma and mourning for residential school survivors and all Indigenous peoples across Turtle Island and the country. The recent findings are a strong reminder of the urgency to implement the calls to action in the Truth and Reconciliation Commission of Canada final report. As an organization, we are at the beginning stages of our journey to implement the calls to action related to health and professional development and training. But we recognize that we have so much more to learn and do in support of healing and reconciliation. Earlier this week, the province has announced that the stay-at-home order issued in April has been lifted. This took effect at 12:01 a.m. yesterday, June 2nd. With the stay-at-home order lifted, people are now allowed to go out for non-essential reasons, such as distance outdoor gatherings of no more than 5 people. The lifting of the stay-at-home order does not change the way that businesses can operate. This change will take place once we reach step 1 of the provincial roadmap to reopen. Although the stay-at-home has been lifted, the emergency brake is still in effect until at least June 14th. Public health measures must still be followed, such as physically distancing from people you do not live with, wearing a face covering indoors and outdoors when distancing is a challenge, coughing or sneezing into your sleeve, washing hands often, and self-isolating immediately, and completing the provincial self-assessment if you're feeling unwell. Until we're able to increase the number of people who are fully vaccinated, our only way to keep the virus from spreading is for everyone to continue to follow public health measures. Together, we can make this our last shutdown. With that, I'd like to now hand it over to Ms. Mantha to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. So in the last 7 days, we've had 12 new cases, bringing the total case count to 456 across our district, 287 of those within the Nipissing district and 169 in the district of Parry Sound. We currently, as of today, have 17 active cases in the district. 18% of these cases are linked to outbreaks outside our district. The most common exposure source for cases over the last 7 days is having close contact with a confirmed case. 42% of our recent cases fit this criteria. Provincially, we have seen a drop in daily new cases below 1,000, and this is a really good sign. Locally, we are also seeing a slow decrease in cases in the past 7 days. We are definitely on the right track, but can't let our guard down just yet. As Dr. Chirico mentioned in his opening remarks, we all need to continue to follow public health measures and get vaccinated in order to be one step closer to getting back to all of the activities that we enjoyed prior to this pandemic starting. Yesterday, we learned that the province will not be reopening schools for in-person learning for the remainder of the 2021-2022 school year. This means that elementary and secondary students in our district are entering their 3rd month of remote learning and will finish out their school year virtually. It's very difficult to put into words the tremendous toll that school closures and remote learning has on students and on their families. We know, and we've said before, that an in-person school environment has a positive impact on mental, social, physical, and emotional well-being of children and youth. As you know, we've advocated for students to return to in-person learning for this school year. Yesterday, with the provincial announcement, we are now shifting our focus to a really successful return to in-person learning in September. We will do this by getting vaccinated, getting our youth vaccinated, and continuing with all the public health measures so we can keep our community transmission rates of COVID-19 as low as possible. And with that, I'll hand it back to Dr. Chirico.
Thank you, Ms. Mantha. Now to Ms. McLellan, who will provide an update on our vaccine rollout this week.
Thanks, Dr. Chirico. Good morning, everyone. I'm happy to say that the health unit met the provincial target of having 65% of adults 18 years of age and older having received at least one dose of the COVID-19 vaccine by the end of May. As of yesterday at 3 p.m., 67% of adults 18 years of age and older have received at least one dose of the COVID-19 vaccine. Also, as of yesterday at 3 p.m., we have provided 75,368 vaccinations in our district. Last week, the province announced that Ontario would be accelerating the rollout of second doses of the vaccine. If there is sufficient supply, Ontario anticipates that residents who choose to receive the vaccine will be able to be fully vaccinated by the end of the summer. As of May 31st, individuals 80 years of age and older are eligible to receive their second dose of vaccine at a shortened interval, and starting June the 14th, individuals 70 years of age and older will be eligible to book their second dose appointments as well. Individuals who qualify for a shortened interval who already have a scheduled appointment can call the provincial booking line to book their appointments sooner. Individuals can also change their appointment online at ontario.ca/book-vaccine or by calling the provincial booking line at 1-833-943-3900. In addition, first dose youth vaccination clinic appointments are available to book for those aged 12 to 17 and are being offered at 5 locations across the district for the weeks of June 14th and June 21st. Please check our website for exact dates, times, and locations. Appointments can be booked online at ontario.ca/book-vaccine or by calling the provincial booking line at 1-883-943-3900. Youth are also eligible to book into our regular mass vaccination clinics across the district if they so choose to. As always, we encourage everyone who can do so to book their vaccine appointment through the online provincial booking system at ontario.ca/book-vaccine. And with that, I'll hand it back to Dr. Chirico.
Thank you, Ms. McLellan. So that really concludes our prepared remarks. So we'd like to begin answering questions. If you have questions, please type them in the Q&A at the top of the screen and our moderator will read them out loud, and we'll try to cover off as many as we can. And when possible, please ensure that your name's attached to the question. So Catherine, if you can begin with the questions, please.
Thank you, Dr. Chirico. Our first question is for Dr. Chirico from Jennifer from the Nugget. She asks, would you like to see the province enter step 1 before June 14th? Why or why not?
That's an excellent question, Jennifer, and thank you for raising it because I think it is a very important issue. We said it many times before that the quickest path to a prolonged and sustained reopening is not opening too soon. I think we have to be very aware of what is going on currently and also learn from our previous experiences, which was that when we had the second wave in decline, similar to now, it was at the beginning of the rise in the Alpha variant or the variant originating in the UK. And that showed that we entered into a third wave, which was even more significant than the second wave and brought our healthcare system to the brink of being overwhelmed. So I think we need to keep that in mind. If the numbers continue to move in the right direction, and that we look at many factors such as the healthcare system, how they're coping with the increases in this new variant, the Delta variant, if it starts to continue to increase significantly, which there are some predictions that is currently happening and may overtake the Alpha variant. We're seeing that this particularly in Peel, that we need to be very cautious of any loosening of restrictions. We do not want to repeat what happened before. I think that we need to be very careful and move slowly in a staged approach. So we need to assess the situation continually before we make the decision. But to answer your question, I do not. I would not recommend loosening restrictions before the 14th, and then reassess at that time.
Thank you. We are seeing many questions pertaining to the province not returning to in-person learning. So these questions will be directed to Shannon and Dr. Chirico. The first one comes from Sarah from the North Star. The health unit supported in-person learning, but the province is keeping schools closed. Can you explain exactly the arguments the health unit made to the province in support of in-person learning, and speaking as if you were with friends and family, share your thoughts on the continuing school closures? We also have a question from Jennifer from the Nugget. Are you disappointed that the province decided not to reopen schools before the end of June? Was input provided by the health unit to the province? And we also have a question from Eric Thompson from the Tribune. After advocating for a return to in-person learning, are you disappointed the province did not take a regional approach to reopening schools?
If you like, I could start, and then Shannon.
Sure, that sounds good. Yeah.
Okay. Yes, we are disappointed. I think that when we weigh the benefits and the risks, we felt that the risks were manageable, and we felt that the benefits outweighed the risks, and that's why we recommended to have in-person learning. We saw a significant impact on the mental, social, and physical well-being of kids. We saw how it affected them. We were being alerted not only by schools but by primary care as to the increase in mental health issues that were occurring, and we felt that we had worked really successfully with school boards up until this point, and we were able to prevent outbreaks within schools, and transmission has been low within our district. And that is one of the biggest contributors to school outbreaks. So we managed, because of the sacrifice and hard work of everybody in our communities, to keep our numbers low. We felt that it was reasonable to recommend to reopen the schools as soon as possible. Given the fact that the province ultimately has that decision. The decision's been made, we move forward, and we now focus on the importance of getting everybody immunized as soon as we possibly can. Shannon, did you have any added comments to that?
Sure, I'll just add that, I mean, I echo Dr. Chirico's sentiment of disappointment. That being said, we truly understand, I mean, the disruption to the 2021 and 2020 school years is really, it's unprecedented in modern history. So, and the complexity of the decision making at the provincial level is unprecedented as well. So, you know, we do understand, while we've advocated for in-person learning definitely in our district, we do understand that there's other factors that came into play in the provincial decision. And I think, as I said earlier, you know, we're shifting our focus now to ensure that the return to school in September is really successful. So this is going to mean having supports available for students over the summer and their families, as well as, you know, really prioritizing student well-being and when they return to in September. And, you know, really that's all I'll say for now, but yeah, thanks for it's a good question.
Thank you. Our next questions are still in the topic of schools, and we have two questions in regards to school graduations. Our first question is from Chris at Bay Today. Does the health unit support outdoor high school graduations? And we also have a question from Jennifer from the Nugget. Premier Ford announced approval for outdoor graduations yesterday. Do you think that can be done safely, considering right now we're only allowed to have 5 people outside at one time?
So I'll take that, and then if anybody wants to add to it. So I would say it's really early to give an answer to this question. We are similar to the media and the public. We're just reviewing all of the information released by the province yesterday. And we'll be consulting with our school boards as well, as we have done throughout the pandemic, about the ability for them to have graduations. We're just not sure what that would look like, keeping in mind all of the public health measures. So I think it's a bit early to say if we're supportive or not supportive, but definitely we'll work with school board partners on this.
Thank you. Our next question is for Andrea from Sarah at the North Star. What percentage of healthcare workers and first responders have now been fully vaccinated?
Great question, Sarah. Unfortunately, I don't have that information readily at hand, but we can certainly get that information to you after the press conference.
Thank you. Our next question comes from Eric Thompson from the Tribune and would be for Andrea, and perhaps Dr. Chirico would like to add. The Premier indicated he would not be making COVID vaccines mandatory for students to return to in-person learning next fall. How important will student vaccination rates be in order to safely reopen schools next fall?
Could you read the last part? I didn't quite catch that.
The Premier indicated he would not be making COVID vaccines mandatory for students to return to in-person learning next fall. How important will student vaccination rates be in order to safely reopen schools next fall?
I think it has to be a combination of both vaccination rates as well as measures, public health measures being put in place. We can't always predict what the situation is going to be, as we've learned throughout this entire pandemic. The situation evolves quickly and changes quickly, and our advice and recommendations also have to change with the emerging evidence. So it really is going to depend on what is circulating at the time, what the significance is of the virus that is circulating and the variant, as well as I don't think we can actually put a number on how many we would need to. What you're talking about is herd immunity. And again, that's an elusive number. Nobody has the exact number because for many, many reasons, as we've talked about before. So I think that the objective is really to get as many children vaccinated as possible, as many staff vaccinated as possible, as many of the entire population vaccinated as possible, and get second doses into everybody, because that gives you the best coverage. So that's our goal, to attempt to do that and get that done by the end of August for the beginning of the school year. So everybody really plays a part in ensuring that we have the lowest risk possible for our children going back to school. And again, I've stressed over and over and over again that the best way to do that is to keep community transmission low, and we all play a part in that. And the things that we can do and can control are getting vaccinated and following the public health measures and using really good judgment, because everybody knows what they need to do. And that'll be their best opportunity to keep the risk low for our kids.
Thank you. Our next question is for Shannon and comes from Rich Coffin from Moose FM. The province is very concerned about the VOC from India, but with only one case locally attributed to this VOC, should the province have given more consideration to regional opening of schools?
Sure, so I'll just comment on this, and Dr. Chirico may wish to add. You know, earlier in the pandemic, we did have the opportunity to comment region by region, and they did take a regional approach to schools and school reopening. And this time around, following the third wave, there wasn't that option to look at the regional approach. And we respect that it's the province's decision to either close or reopen schools. I think, you know, I'll let Dr. Chirico speak more about this, but really going back to his earlier comments about the new variant, and just because we have one confirmed case doesn't mean that we don't need to not be vigilant about it. And he said over and over, you know, we're not an island, and we do know that Our southern neighbors in Peel have it's emerging quite a bit as a lot of cases of the new variant. So I think with that, I'll hand it over to Dr. Chirico, but we're supportive of the provincial decision making a decision across the province. We were just hoping for a different decision.
Yeah, I agree with what you said, Shannon, and that we respect the decision the government makes. There's lots of factors that are involved, and it's not difficult. It's not an easy decision. It's a difficult one, but it was made. We need to work together to ensure the safety of the children and for safe reopening in the fall. I think that we need to be very careful in reopening the province, given, as you mentioned, this new Delta variant that is spreading quickly. It's even been predicted to be more transmissible than the Alpha variant from the UK originating there. So we need to be cautious in how we move forward with this.
Thank you. We now have a question for Andrea from Jennifer from the Nugget. Have there been any adverse effects of the vaccine on children in any of our clinics?
I am not aware of any adverse events that have happened in any of our clinics with children who've been immunized, but we can confirm that and let you know if there is if we have heard of anything.
Thank you. Again, for Andrea from Sarah from the North Star, the uptake of youth receiving the vaccine seems high even before the specialized clinics. Is the health unit pleased with the number of youth vaccination already?
Yes, we are very pleased with the uptake of vaccine within the school age group. I actually attended a provincial meeting yesterday, which they reported as of June the 1st, 11% of our youth have received their first vaccine in our district, which is great. And based on the clinics that we currently have up, which only went live on Monday for parents to book into, an additional 25% of our youth are booked into appointments. So that brings us to about a 36% covered or uptake so far, and we're only 3 days into availability of appointments. So we're very pleased with the response from that group.
Thank you. Our next question comes from Chris from Bay Today, and he also sent an addition to the question. So he's asking, what will it mean to our region when we hit the 70% first dose vaccination level? Meaning, does the health unit feel more things can open once we hit that number?
I'd certainly like to take I'd like to answer that one in that I think that we have to be really careful about one specific number. Yes, it's great that we reach a spot of 70%. However, we can't use that in isolation as to decision making. We need to look at all the factors, as I mentioned before. We need to look at what does it mean to the actual clinical situation, which is, are people getting more and more ill, even if there's fewer of them? Are they ending up in hospital? Are they ending up in the ICU? Is the healthcare system becoming overrun? Is public health able to keep up with the ability to manage cases and contacts to get them isolated? I think we need to look at the trends of the time. So the number in itself should not be the determining factor. You have to consider everything. But if once we reach 70% and more information is available to determine is that the number that is going to provide us with the herd immunity, as well as all the other factors that I've just mentioned, that need to be assessed at the time to determine is that the time that we loosen restrictions. So everything needs to be considered. Andrea, you may have other comments.
The only other comment I would add to that is that 70% is but one metric that the ministry will be using to look at immunization rates. They'll also be looking at the second dose rate of 20%, 70% first dose, 20% second dose, as one factor in a multitude of factors that will determine the reopening process.
Thank you. The next question is for Andrea or Dr. Chirico and was submitted anonymously. Do we know if there are any public health units in the province who did not meet the 65% vaccination target? No names required, only if this goal was achieved cross-provincially, please.
I'm not 100% sure on that. I will double check. I know that I've seen a slide with it. I don't want to say yes or no until I confirm it. So we'll get back to you with an answer to that question.
And I think we have to also preface it by saying that every health unit is in a different stage in the rollout of vaccines, depending on what their supply was. So I think you have to be careful in how you interpret that. I think that given what was available, I think all the health units have done an exceptional job to get vaccinations completed to date, and that the strategy of getting as many vaccines into first doses into arms so that everybody, the majority of the population, has some form of protection has been accomplished, and we continue to build on that. And now we're focusing on getting even more people first doses, as well as starting to get second doses into as many people as possible.
Right, and I would add to that as well that the 65% was a provincial target, not a specific target each health unit was expected to meet. So it was a provincial goal.
Thank you. This will be our last question, and it comes from Jennifer from the Nugget and will be for Dr. Chirico. Do we know if the vaccines currently being administered will protect people against this new variant?
Yes, overall, all of the vaccines have been shown to be very good at protecting against severe disease and hospitalization and death with the variants. Some less than others when it came to sort of one dose, as well as just preventing the variant of getting symptoms, but they're all very good at getting some protection against severe disease and hospitalization and death. So that is why we are certainly, our goal is to get second doses into as many people as possible as soon as we can. So you have full coverage. But we always are vigilant in surveillance and learning from what is going on in other countries that may be faced with similar issues, and to see what is happening in those countries as well.
Thank you, Dr. Chirico. Thank you, everyone, for joining us today. For those who have asked questions for which we will need to follow up with, will be posted on our website as long as the recording for this press conference. We will see you next week.